Okay, so this is being recorded, but can everybody see and hear me okay? Please just let me know. I just want to confirm. Um, can you guys see me where I'm large, or is it a really small picture? And Paige, thank you for letting me know. That's perfect. Because I feel like I'm like echoing because I'm in such a big room right now, I think, and I'm trying to talk a little bit louder so you guys can hear me. Here, let me move this closer because the mic on my laptop is like up here and I don't know how good the sound is, but everybody's okay. I'm not hearing complaining, so that's always a good sign. That's awesome. Um, yeah, and I'm hearing somebody's mic. If you guys could turn off your mics as well, it's not letting me. Ah, never mind. I figured it out. Oh boy. Think I figured it out, but I can't turn off the videos though. I was able to turn off the mics for everybody, but the videos, I can't seem to do that. But as long as you guys are okay and can see me, that's awesome. I won't be sharing a screen today because on my Mac here, it just makes it a little bit difficult. And I wrote out notes on my iPad because I posted yesterday that I took a course pretty much on like privacy, confidentiality, all of that stuff. I took a course a couple weeks ago. So I do have it all kind of in my notes here that I'm going to be talking to you guys about confidentiality, ethics, law, you know, all of those types of things. Now, just as a reminder, I do live in Ontario, so this will be, most of it is pretty similar anyway. So even if you guys are from the States, whatever I'm talking about, the same rules apply, except for a couple things, which I'll try to remember to mention the rules that are a little bit different, but there's not many. And even depending on where you live, certain things like age of consent will be different. So even if you all say lived in the States, it depends on what state you live in for, you know, age of consent as an example. So it's 10:01 now, so I will officially start in a couple minutes, but I just kind of wanted to give you guys the overall picture because I'm sure all of you are thinking, okay, so will this apply to me? Yes or no? This will apply to everyone. Where it's different, I will mention that, okay? The nice thing about the state's exams is you won't hear a lot about specific laws because I think they are starting to realize that those who take the state board exams might also be moving to Canada, or at some point they were from Canada, moved to the States. So they try not to mention anything specific like laws, but they'll mention kind of the overall. So I'll be going through some questions today too. I don't have them on a PowerPoint because I didn't have access to my computer and my Mac was just being weird. So, but there were so many anyway that it would probably take me hours to kind of type it up. And I thought that it would be nice anyway to just talk about it because it's all the same thing. And this way you guys don't have to read. Just listen. You'll probably want to listen to this session a couple times even because this will be excellent. And Rita's asking if we could do the sessions half an hour later. Actually, Rita, that might be fine. It just kind of depends on the weekend. But half an hour later is okay because I know you have to wake up pretty early, right? What time is it though for you now? It's 7 in the morning? Okay, yeah, no, I can understand that. That's pretty early. So half an hour later, I might be able to do that. It just depends on the weekend. I'll check about next weekend if I can do it half an hour later, or sorry, not next weekend, the weekend after that. But I will definitely let you know. But keep in mind, and this will go for everybody, when you guys start working, you'll be waking up at 7 o'clock, probably the latest. I'm lucky when I work as a hygienist, I usually work like the late morning or the afternoon shift. So well, I usually wake up at 7:30 anyway, but I know when I was a student, I'd be waking up like 9, 10, 11, so I totally understand. But it's kind of good to get used to the earlier times. As horrible as that may sound, but at some point you guys will have to wake up super early anyway. And the nice thing is you don't have to go anywhere for these tutorings. You can just, literally you could be in your pajamas having a coffee. I would have no idea. And I will not be posting a PowerPoint later because I don't have one for this. This is all from my notes that I have taken from a course that I took about 2 weeks ago. So I did learn a ton of things. And thank you guys for hopping on. I can see who is attending today, so that's perfect. I'm just changing a couple views here. And is everybody able to keep on checking out the session recordings afterwards? So even if you're not able to attend it live, please make sure to check out the session recordings after that, okay? Because I do upload the session as soon as I can, so it usually takes a couple hours. Yeah, I can't shut down, because I look, whoops, I just made it full screen and now I can't see anything. Oh, well, that's okay. Just as long as you guys can see me and hear me, that's the main thing, okay? Awesome, awesome. So hi, you guys. Thank you so much for hopping on super duper early. I know it's 10 o'clock here, so I've been up since like 6 anyway, but ethics and law is, I don't know, I find it very interesting. I don't know about you guys, but I find it interesting. But the kind of bad thing about ethics, law, privacy, confidentiality is that a lot of them, it's not common sense, okay? So let me just go back to my notes here. So the first thing actually that I want to talk to you guys about, and then in about half an hour, I will ask if anybody has any questions though. But allow me, if you guys don't mind, to talk about it first for about a half an hour, because I might be able to answer a lot of your questions, okay? But I will be asking some questions too, okay? So I just have my notes here, just in case you guys are wondering what I'm looking at. And that's okay. If anybody has to leave early, that is totally okay. Just please make sure to watch the session afterwards, because I find after a session, a lot of people email me and kind of ask me the same questions. So I know I say this every time, so I do apologize for those people who do actually listen. But please, please, please post your questions in the private Facebook group, because that way other people probably have the exact same questions, and then you're helping everybody, okay? Because what's easy to me, or what I might think you understand, you might not, right? So I love, sorry, my hair is driving me crazy. I love questions. Okay, that piece is not going to go away. But I love questions, because that tells me you are looking, you are learning, and it's not normal to understand everything. It's not. If you think you do, you probably don't. So please ask questions. Okay, so the first thing that I want to talk to you guys about is, and this is something that they always ask on the board exam in one way or another, and that is what is supposed to be private and what is supposed to be confidential. So both terms mean the same thing, okay? Think of confidentiality is just keeping what the patient says to you confidential. So you're not telling your mom, sister, brother, aunt that your patient came in today with horrible oral hygiene. We all do it. Yes, we do. Like, I talk to Tom often about my day at work and certain patients, but do I mention their first name, last name, address, date of birth? No. But pretty much anything though, even if you're just talking about your patient, you're not supposed to with other people, okay? So everything they say, everything they do needs to be kept confidential and private. And same thing with their charting. You would not just simply allow anybody to see their chart. You would not bring their chart home and allow your husband, wife, girlfriend, boyfriend, brother to look through it for the heck of it. A perfect example is as a student, you're not allowed to bring the charts home to review your cases and take notes or to finish the chart at home. And that was something that I never understood as a student, because I kept saying, well, here I'm spending an hour just looking through my charts in clinic, in your program, where can't I just take them home and write my notes there? Like, what's the big deal? I'm not going to show anybody, right? But it is a big deal, because from your school or the office to home, you could get into a car accident, and those charts are sitting there on your, the front seat of your car for anybody to look at. You didn't mean to get in a car accident, or you didn't mean to lose those charts, but you have to keep them safe at all times, especially these days. You might have client information on a USB stick or a CD, a DVD, emails, cell phone, whatever. Those all need to be kept safe. So think of the computers in your office or in school. They should all be password protected so that not just anybody can look there and look up a patient. What else? And in the office too, so this is a typical board exam type question, is if you're ever leaving the room, whether you have a patient or not, you are supposed to be locking your computer so not just anybody can walk in and look up patient info. In the real world, do I do that? No, I don't have time for that, okay? Every time I leave the room, if I had to lock my computer and then open it up again, it would just take too much time. But that is what you're supposed to do. Is everybody okay so far? I mean, this one's kind of common sense, but I just would like to make sure that everybody's okay with that so far. If you're not, at any point, stop me. I do not mind. Let's see here. So same thing with, let's say you've known your patient for years and years and years. And they were just telling you, hey, this weekend I plan to go to the States shopping with my sister. I'm excited, and they're just telling you about life, about whatever. If you see them in public, you're not allowed to say, hey, this must be your sister. How did your States shopping trip go? That might seem completely harmless, which I probably would, honestly, but in the board exam, you're not allowed to discuss anything that they talk to you about in the office outside the office. So is everybody clear on that one? It doesn't matter how innocent it may seem, but you're not allowed to. If you're not clear, or if you need me to repeat something, let me know. Same thing. And this one actually surprised me. Okay, so listen up. So when I took the course, this part actually surprised me. When, let's say, something about a patient is common knowledge. And the example that they gave in the course was, if the mayor of the city, if in the paper, so in the newspaper or online, it says that the mayor had their wisdom teeth taken out. So that's common knowledge because that's published, it is online. And let's just say that the mayor had them taken out at your office, or even if it wasn't your office, but you know that the mayor had their wisdom teeth taken out. You're not allowed to talk about that with anybody else outside the office. So you would not be allowed to say, well, yeah, the mayor saw us on Tuesday afternoon. He's such a nice man. He did a great job. That's common knowledge that he did have his wisdom teeth taken out because it's in the paper. But you're still not allowed to say anything, even if everybody else knows. Even if somebody brings it up, saying, hey, so I heard that the mayor had his wisdom teeth taken out. How did he do? You're not allowed to talk about it, okay? That surprised me because I would have thought if it's common knowledge, well, why not? I'm just making, small talk, but you're not allowed to talk about it. Okay. Okay. So let me just move on to that. Let's see here. Let's see. So, and okay, so I wanted to also say, so privacy and confidentiality. So they mean the same thing, but they're a little bit different, but they're kind of encompassed with each other. So privacy is just privacy overall, okay? But confidentiality is that we need to keep their records private and confidential. Whereas privacy is just talking about everything. So everything that they say to us is, private. But I don't see them asking you those specifics on the board exam. But I do get a lot of questions of, well, isn't privacy and confidentiality the same thing? It really is the same thing. When I say I'm keeping patients' information private and I'm keeping patients' information confidential, to me, it means the same thing. One day I might say that I'm keeping the information private. The other day I'm saying I'm keeping information confidential. To me, it means the same thing. But just so you know, if they're ever specifically talking about the client records, x-rays, charts, that is confidential. See, I had to look it up again because I'm like, So yeah, confidential. Like records, x-rays, charts, things like that. And anything, you guys, talking about privacy and confidentiality is under, and make a note if you want to, the personal information protection. Oh, no, sorry. No, I'm talking about charting on the computer. But, okay, here it is. So keeping things private and confidential is under the Personal Health Information Protection Act 2004. For some reason, they want you to know 2004. So let me just make a note of that. I'll type it in the chat box. Health information. There we go. Pardon me. I didn't think to get water. I should know better. Okay, so anything that is I just send that to somebody privately. Sorry, Paige. Let me just send this to the group here. There we go. So anything that's talking about privacy or confidentiality is under the Personal Health Information Protection Act 2004, okay? That is something that they might ask on the board exam, okay? They like to ask weird things. Now, another thing that I want to mention is there has to be somebody as a whole who is supposed to be responsible for all of those charts, all of the documents, anything private. It is called what is that? That is called, they call that person an agent overall. And that ties in with the Personal Health Information Protection Act. So there is one person that has to be held accountable. So if anything happens. So the example that they had given in the course was, let's say I am, I'm working for an office that handles only sports guards and whitening. The owner of the office isn't a dentist. The owner of the office could be, just Mike from down the road who knew that I wanted to open up my own practice doing something. He said, oh, well, I have the money. How about I pay half, you pay half, and then we share the profits, okay? But as a dental hygienist, an assistant would not be able to open up their own practice. But as a dental hygienist, we can, if you're self-initiated. I need to appoint somebody else to be responsible for everything, okay? So it does have to be somebody else. I don't know why. I think that's very weird. You would think I'd be allowed to be responsible, but it has to be somebody else who is responsible for everything. So if anything happens, if I decided to take my laptop home, I have all of the patient's info on my laptop. I did all of the right things by putting a password, you know, everything, but I lost my laptop. Something happened. I need to tell Mike, who's responsible for all of that, and he would need to go through the necessary steps. Okay, so that's just something that I wanted to mention too, because that was another thing that surprised me, was there has to be somebody else responsible for everything. Okay, and this is the same for the states, for Ontario, it doesn't matter. So it is the same everywhere. So I did have a question if that applies to everywhere. Yes, it does, but keep in mind, depending on where you live, a dental hygienist might not be allowed to open up their own practice. So if where you live we are, then the rules apply. If you live somewhere where we're not there yet, then you would not have that rule anyway. So I just wanted to mention that. Okay. So on the board exam, they had a question and somebody told me this. So when they took their exam, what, I'd say almost a month ago, excuse me, almost a month ago, there was a question about, she said, the question was, you as a dental hygienist had taken a USB stick home that contains personal information from your patients. It is a backup USB for the office. So I guess part of the case study was that you as the dental hygienist are responsible for taking that USB home as a backup. Whatever, right? They have weird questions, but you were responsible for that. But somebody broke into your house and took that USB stick. So this case study, like, they went all out. But anyways, but the question was, what did you have to make sure you had done since you were responsible for that USB stick? Okay, so what are some of the things that you have to make sure to do if you are taking the patient's private, you know, stuff home? Okay, so, and it was specific to anything that is electronic. So I had kept some notes here. So just pretty much it has to be encrypted and password protected. So simply being password protected doesn't matter. It has to be encrypted as well. I don't know what the heck that means. I'm assuming it just means certain things on the computer to make sure that not just anybody is able to log in. So maybe that means you need 2 passwords, who knows? But it needs to be encrypted and password protected. And it says that you need to make sure to not share that information with anybody. So do not give your password out to anybody else. And all electronic devices should at minimum have a personal firewall, antivirus, and anti-spyware programs that are up to date. Use a lockable briefcase or laptop case that does not have any logos of your practice or business. Only conduct confidential work on mobile devices over which you have control. Do not use public Wi-Fi or networks. Makes sense, right? Beware of public wireless networks. So again, do not use them. When you travel with personally identifiable health information or collect new information off-site, you are responsible for ensuring the privacy is protected. So does anybody have any questions about those? So pretty much if you have anything private, like if you did own your own business, you might have your own laptop. That is your computer with all of the patient appointments, info, credit card info, all of that, and you take it home. You know, that is allowed, but it has to be password protected, has to be encrypted, has to have personal firewall, antivirus, and spyware programs installed. You're not allowed to just simply take out your laptop and take it home. You have to have a lockable laptop case, which I I didn't know that. And do not use private, do not use public Wi-Fi networks. So I'm not seeing questions, so that's good. So I guess you guys are okay with this. Perfect. But yeah, that was a question on the board exam. Rita, are you asking why would you take the patient info home? Well, only if, like, let's say, and I've seen it, where you open up your own office and your laptop is your main computer for the office. So you have the patient appointments there. The charts might be on the computer, so instead of paper charts. So then at the end of the day, you like close it up and take it home because that's your personal computer and the business computer. That's the only reason why you would take anything home. I've actually seen dentists take charts home to write notes in the chart at home. So having the same things apply. If you are to take charts home, it would have to be like in a lockable laptop case or whatever, a lockable case of some kind, but it's obviously not ideal. So that's the only kind of reasons that I can think of. But yeah, you really shouldn't be doing that, right? Because why? But yeah. But what I want to talk to you guys about next, so I just touched on that sort of briefly because I was surprised that they had a question like that on the board exam. So that means that they will likely have it again. So I just wanted to make sure that everybody understands that. But the next one is, and this is where it gets tricky, everybody. So we talked about it on Facebook a little bit. I did ask some questions, but not a lot of people were answering them. So I didn't want to kind of post more questions on Facebook if nobody's going to answer them. So I just thought it'd be easier to talk about it here. So then that way we can talk about it here. But talking about age of consent and, you know, what do you do if a 13-year-old says that they don't want x-rays, but the mom says, too bad, take the x-rays. What do you do if you have a, 16-year-old, just things like that. So do you listen to mom? Do you listen to dad? Do you listen to the stepmom? Do you listen to the biological father? Things like that. In Ontario, so listen up, please take notes if you need to. I know that I would be. I took lots of notes for my course. So in Ontario, there is no age of consent. Students always try to argue this point. There is no age of consent in Ontario. If you need proof, I can send you the document where it says there's no age of consent in Ontario. So what does this mean? So a 6-year-old can say that they don't want x-rays and that's okay? Yeah, yes, that is the case, okay? It's crazy, but it's true. There is no age of consent in Ontario. But another thing that everybody needs to understand is, let's say, let's see, I'm just trying to gather my thoughts here. So let's say a patient, it doesn't matter what age they are, if they say that they don't want x-rays, and you simply say, oh, okay, fine, well, you do have that right, sign here. That's it, okay? And they sue you 10 years later because they have advanced a bone loss, but they said that you didn't tell them. Well, you might not know that without the x-rays, right? You would be able to tell that they have bone loss because of the probing, but not the extent of the situation without x-rays, but just all in all, they sign something and then they sue you. Now, can anybody, and I'm asking the question first because I want to see who knows this. It's a tricky one though. So if you do know this, I will be extremely impressed, very impressed. Can anybody tell me why that case, why the dental hygienist is at fault? So I'll tell you guys the case again. So your patient does not want x-rays. You say, okay, well, that's okay. Sign this paper. that says you are denying x-rays on, what's the date today? October the 13th. Sign here. That's all it says. They sign. And 10 years later, they sue you because they have advanced bone loss and you didn't know. Thinking that if you took the x-rays that you would know if they had bone loss. So then you're saying, well, you didn't let me take x-rays. That's why we don't know you have bone loss. You had signed here. Why is the dental hygienist at fault? Haney, you are correct, but you're missing one kind of point there. So if you could elaborate just a little bit more. Haney says it is not informed consent. Well, explain a little bit more. Marguerite is, yes, that is exactly it. Yes. That's so perfect. Thank you. And you had actually answered that pretty fast. So did I ask an easy question here and I thought it was hard? Did everybody else know that that's why the dental hygienist is not is at fault? Did I ask an easy question? Because I thought that was really hard. So good for you. So you need to inform the patient of everything, okay? It's ridiculous. Like patients are, anyways, so you have to inform them. So even, and I, 10 years ago or whatever, I would not have known that. I would have thought, okay, well, they signed a paper saying not to take x-rays, done and done. Like, okay, that's what they don't want us to do. But no, you need to inform them. So just using another example, even if you come in and your 13-year-old patient does not want the fluoride, okay, which happens all the time. And you say, okay, well, you and your mom have that right to say no, but you need to explain. You need to say, well, just so you know, without it, we like to apply it to make the enamel stronger. Without it, your enamel isn't protected as much. Say whatever you want to say, but they need to be properly informed with anything and everything. If they're not informed and or they don't understand. So there's a difference. Even if you're talking to a patient who you explain why you want to take x-rays and they go, okay, that's fine. But you can kind of tell that they're, what's the word I'm looking for? But you can tell that they don't understand. They may say, yeah, that's fine. But if they don't understand, if they're not capable of understanding, it doesn't matter if they say yes, no, maybe. They need to be capable. Another example is if you're talking to a patient who can speak a little bit of English but not full English, you don't know what they understand. So even if you say to them, I'm taking x-rays today, is that okay? They say yes. I would think, okay, awesome, fine. Like this is easy anyway. What's the big deal? It's not like I'm asking them if I can take out a tooth or not. I'm taking x-rays. They can see me take the x-rays. They can see me pull out the camera. They know everything's fine, If they don't understand, if they don't fully understand, none of that matters. Everybody's okay with that? Please, please, please tell me if you're not, because I've been getting a lot of questions. And yes, Paige, exactly. And this actually happened in my last office too, where we would tell patients, some patients, they don't want x-rays. No. But at some point we would say, okay, 3 years is the max. If after 3 years we still don't have x-rays, he would actually say to them, then you know what, I can't see you because it's my, my career, my line of work, my life is on the line because I can't properly see what's happening without x-rays. So when you decide to come back to me in 5 years to sue me because something happened to one of your teeth, but I couldn't tell without the x-rays, that's on me, not on you. And he would actually say that. Like he was sometimes he had no filter. I don't know how patients liked him, to be honest. He was such a nice man, but sometimes he really didn't have a filter. But anyways, so yeah, and I think that makes perfect sense. I think every office should do that. It's like, okay, then go somewhere else. But that's the thing though, right? Is they will always go somewhere else. And these days there's so many offices that we try to hang on to the patients because we want the money, right? I wouldn't. Seriously. There are so many times where I just say, okay, that patient was rude. It's not necessary. I will not see them. And my boss kind of says, well, okay, calm down. You know, we have rude people all the time. You should still see them. You know, how about give them another chance? I'm like, no, you see them then, you know, but that's just me. I'm not saying act like me. I'm not saying it's right. I'm not saying it's wrong, but I think I've been doing this for a long time now that I feel like I'm entitled to certain things. Like respect, as we all are. But anyways, wait until you guys start working. Wait until you start working. It's happened to me because I've been in a new office now since March. It's happened to me several times where I'll have, which I take it as a compliment, kind of. But I have patients go, how long have you been out of school for? I don't want to see a student. And I'm thinking, okay, students, you guys, have to learn somehow. That's just disrespectful, okay, to pretty much say in front of my face, I don't want to see a student. But then I say, I've been doing this for 14 years. But okay, if you don't want to see me, no problem. I'm going to go have a coffee so you can rebook with somebody else. But then they always go, oh, shoot, sorry. And I go, no, too bad. Rebook. But that never works because the receptionist just makes me see them anyway. So good luck out there. Good luck. You will have patients that are like, I don't want to see a student. It's dumb, but it will happen. But yeah, you guys, okay, so I talked about different types of consent here. Sorry, I'm just checking my notes for one moment. So the main thing that I want you all to take out of that is just because a patient signs something means nothing, because they could say, well, I signed it, but I didn't really know what I was signing. Unless it says exactly on that paper, like everything you had said, everything that you had explained, it means nothing, okay? So the paper might as well be 3 pages long, but it does have to be very, very detailed. Let's see. Does everybody know the difference between formal consent, verbal consent, and implied consent? Does everybody know the difference? And if you guys could kind of explain them to me. It doesn't have to be long, but just explain the differences between formal consent, implied consent, and verbal. Excuse me. And I'll give you guys a second, but if you guys could please explain to me the difference between formal consent, verbal consent, and implied. And I'll give you guys examples too. And if you're not sure, just let me know. But I'm assuming it's quiet because everybody's typing. It would be nice if I could hear like all of you, but I've tried that, and for some reason it tends to slow things down. What do you guys think? What's the difference between formal consent, verbal, and implied? And if you guys don't know, just let me know and then I can move on. But since I haven't heard anything, I'm going to just wait for you guys. Although some of you guys might have stepped away too, so. Yes, awesome. Paige actually said it perfectly. This is exactly what I wanted. for verbal and informed and implied. So, okay, so I will talk about that. So Paige said it perfectly. So verbal is what you talk about. So remember, think you saying, is it okay if I take x-rays today? It's your cleaning and checkup, but it's been 2 years since we took your last checkup x-rays, so I will be taking those today too. Is that okay? And they say, yep, okay. I do this at every appointment. So them saying, yep, okay, tells me that's okay. Informed consent. This is where people get confused. But again, Paige said it perfectly. So informed consent is having them sign something, okay? So technically, we could be having them sign something at every single appointment, which I did. I did that actually for one office, which I forgot about. But saying it will be your cleaning and checkup today. You are due for 4 checkup x-rays. We'll be having a checkup by the dentist. I will be cleaning your teeth and polishing after that. Is that okay? And all of that would be on the paper and they sign it. That is informed consent. So does that make sense? Yes? So it just kind of takes it a step further. Okay, good, thank you. And then implied consent. So that is when, so I've talked about it before, but that is when new patients to your office would sign a form saying that we are allowing them to do any dental work that they have agreed upon, blah, 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 blah. So they sign that. So implied means that they're coming in for their hygiene appointment. They sit down. That's implied consent. So that's meaning that we're assuming that they're okay to have us have their cleaning appointment today, because they're the ones who had confirmed their cleaning appointment. They walked in, said, hello, I am here for my cleaning appointment. And they sat down and said, hello, it's nice to see you again. That's implied consent. So basically, when they sit down in that chair, that's implied that they're okay to be at the dental office, that they understand what's happening, that they know if there's any questions they will ask, and that it's their hygiene appointment today. Yeah? So just a quick one. Verbal is just anything being talked about. Informed consent is when you actually sign something and understand what's happening. And implied consent is when they sit in the chair. Well, obviously they know what's happening. Yeah? Or, we assume. But that's why we're never supposed to assume. Okay, so another thing. So let me ask, whoops, sorry guys. Let me ask a question. So let's say your patient is 14. You have been seeing her for years, since she was a kid. You can tell that her and her mom don't get along, and her mom brought her to the appointment today. You notice she looks a little bit different. She has heavy erosion on her maxillary anterior linguals, and she has told you, so the patient tells you, that she's had an eating disorder for 6 months now. So you're thinking, oh my God, okay. And then she tells you that she hasn't told anybody yet, and she doesn't want to tell anybody. And her family doctor, and you tell the patient that you would like to discuss her treatment with her family doctor. Is that okay? And the patient says, absolutely not. This is just between us. I don't want you to say anything. So what is everybody's thoughts on that whole scenario? So I'll just say it quickly again, kind of in point form. Your patient has an eating disorder. I forget how old I said she was. I think I said 16. Thank you. So I said 14. Thank you, Paige. Somebody was listening. Thank you, Paige. So your patient is 14. You have known her forever. The patient tells you she has an eating disorder. Her mom is in the waiting room. Her mom and the patient, the mom and patient don't get along. The family doctor, you want to help out the patient because you have known her for such a long time. He can help her. You ask the patient if it's okay if she If you can talk about it to the family doctor and she's like, no, can you say something even though she's age 14? And Rita, this is where it gets tricky. Rita is saying that she is under 18 and her parents are responsible, and this is a risk to her health. You have to talk to the parents. I completely agree, but that's not the right answer. In the real world, oh my goodness, I would want to talk to the parents. You are not allowed to. You are not allowed to. And they say because there is no age of consent in Ontario, even 16 or under. They also say, so take notes here if you need to, 16 or under, the parents are responsible. They are. And 16 or under, they don't really know what's going on. You know, they may think they know everything, but they don't. In the course, they made it sound more professional, but I can't think of the exact wording. But 16 or under, yes, the parents are responsible, because how can a 16-year-old know everything? But we're not allowed to say anything. Yeah. Honestly, I promise you, this is true. People always try to fight me, but it's true because there's no age of consent in Ontario. Yes, and Paige is right. Since the patient says that she doesn't want you to talk about it, you cannot. The only thing we're allowed to do is to say, I would highly recommend that you talk to somebody. You know, the best thing that you can do as a hygienist is to help them as much as you possibly can, okay? As much as you possibly can, okay? Talk to them the whole time while you're cleaning her teeth. Keep saying, even at every damn appointment, please tell somebody you need help. You know, feel free to share, you know, personal things if you have a best friend who has an eating disorder, or which, I mean, she might not want you to tell, but you know, that's okay, just as long as your friend isn't a patient. Try to help the patient. And yes, exactly, because the patient has the right to tell you, no, don't say anything, because remember, we talked about privacy and confidentiality. Okay, yes, Rita, perfect question. Oh, Paige, I'm sorry, I just saw that question. So yes, exactly. So you as a hygienist would do everything else that you possibly could to help the patient. So talk about, you know, with your eating disorder, if you are sick, if you are to vomit, don't use your toothbrush for at least a half an hour, because if you do, those acids in the mouth are being pushed into your enamel pretty much. After you're sick, it is a good idea to rinse the mouth with water, because again, that's so acidic. And look at the erosion on the maxillary enamel. Look at this. Show the patient this is what's happening. So yeah, so it is our job to talk about that. But Rita had a question. So what can we talk to the parents about? There's only a couple things. The only things that we're allowed to talk to the parents about, doesn't matter what age, you know, if they're 6, 13, 22, whatever, talk to somebody, is if, okay, so please take notes. And I took notes, actually, that is on my next page. If the patient is going to hurt themselves or somebody else, if they say to you, I'm going to kill myself tonight, don't say anything. Well, too damn bad, you're allowed to say something. If the patient says, I'm going to kill my neighbor, I don't know, you're allowed to say something. If the patient says they were assaulted, you're allowed to say something. If the patient says they were assaulted by their family physician, if they were assaulted by their nurse at the hospital, you're allowed to say something. Even if they say, don't tell anybody, you're allowed to say something. I believe those are it. I don't think I forgot anything. Those are what I have in my notes here. So now another thing that I thought, I didn't know this, but remember how I said for sexual assault, if it's a child or a minor, you are allowed to say something, or a senior. So a child or a senior, you're allowed to say something. If it's an adult and they don't want you to tell anybody, then you have to respect that because they're an adult and you're not supposed to say anything. Did everybody hear that? So for, you know, for a sexual assault for a child or a senior, you're allowed to say something. For an adult, you're not, because they have to do that. But there's an exception. I shouldn't have said that. I should have asked you guys the question first, so my bad. So maybe if you guys weren't listening, I'll ask the question anyway. So let's say your patient was 36 years old. That means they are an adult. If they tell you their nurse at the hospital, I don't know, their doctor, if they told you their doctor had assaulted them at their last appointment, but they don't want you to say anything, they were just looking for somebody to talk to, what do? Do you tell somebody? Your patient's 36, their doctor had assaulted them at their last appointment. They don't want you to say anything. In fact, they say, don't you dare say anything. I just need somebody to talk to. Do you report that? Yes or no? Haney is right. Haney, you are on a roll today. Paige, what do you think? This is a very small class, so I can ask all of you. Unless Paige has stepped away from the computer, that is allowed. So I'm just going to say that one more time. Your patient's 36. They tell you their doctor had assaulted them, but don't you dare say anything. They just needed somebody to talk to. That is the exception. You're allowed to say something. Yep. If anything happens under the care of another professional, you're allowed to say something. I know, it's weird. So if the person who did the assaulting is a doctor, a dentist, a massage therapist, you know, a professional, you're allowed to say something. Yeah, I know. I didn't know that. But that is the exception. So on the board exam, let's say, yes, Paige, thank you. Because that would be malpractice, right? Because you're not allowed to just go on assaulting people. That sounds horrible, but you know what I mean, right? We have laws. We have codes of ethics that we have to follow. So even if it's an adult, if they tell you that they were assaulted by another professional, you need to report it. Even if they say, don't you dare say anything, you have to. Did everybody write that down? Because I could see them asking you something like that on the board exam. And a lot of people didn't know that, including myself. I didn't know that. So I'm so happy that I took that course. But I'm sorry, oh my gosh, it's like 10:50. Does anybody have any questions? I'm going to actually do another session on this because this is really some good things to talk about. Okay, so Paige has a question. So she said that she had a question in 2017 that had asked about the ownership of medical records to be sent out. The patient owns the information on the chart, but the dental office owns the chart records. Would it be okay for the dentist to charge a fee to have the records sent out? Seems odd to charge a patient. That's a great question. And they actually talked about this in the course. So wow, that is a great question. What do you guys think? Can they charge, yes or no? And once again, Haney is on a roll. You're right. You're the only one who's right. Okay, if it was my office, I would charge. Seriously, why not? But you're not allowed to, you guys. Yeah, we're not allowed to charge because that is theirs anyway. So the question was kind of misleading because the dental office, it would not ever own the patient's chart, if that makes sense. It's always the patient's. So they could ask for it anytime. If it's a paper chart, if it's on the computer, if it's x-rays, it doesn't matter. They can ask for that anytime. So Paige, that was not really a fair question for anybody who had that because like part of the question is misleading. So yeah, in the course, it did actually say that a lot of offices want to charge because they want to keep the patient there. So, you know, if there are so many patients out there who will literally leave an office for like anything. Oh, my assistant was 10 minutes late. I'm going to go find somebody else. Oh, my hygienist was mean to me and told me that I need to brush twice a day, so I'm going to go somewhere else. I know a lot of patients where like this is their like 6th office of the year, okay? So a lot of offices want to charge because it's kind of like, okay, well, if you want the records, we're going to charge you because, you know, we know this is your 6th office. Somebody has to teach you a lesson. So maybe if we charge you, you won't just be going from office to office to office, but we're not allowed to. Yeah, it's stupid. I think so. It's interesting though, how we're not allowed to charge for that, but we're allowed to charge if the patient no-shows. So think about that one. What are everybody's thoughts on like that one? So we're not allowed to charge to give a patient the chart, but we're allowed to charge if the patient no-shows, which I completely think makes sense. If a patient is late, if the patient no-shows or cancels, I say we should always charge them, teach them a lesson. I know my doctor's office has a note in like every single room in the front on the hall saying they will charge if less than 48 hours notice is given to cancel. And it says they charge $75, which makes sense to me. Yeah, that is like awesome. So Paige says that their office charges $50 per hour. That is really smart. That's a great idea because I know I've heard of offices charging $50 for like the whole appointment. But yeah, no, you make a good point per hours. Like awesome. If I had my own like office, that's what I would do for sure. Yeah, like I think they should charge, but for some reason they just don't. Yes, exactly. Now, I apologize that I didn't know it was so late. Does anybody have any questions about anything? I did say after like a half an hour, I would see if anybody has questions, but of course I forgot. And I do think that we'll still talk about this the next time because there's still more that I wanted to cover, but we did go through like the major things today anyway. Just a quick thing to note, it's tricky when you're seeing like a 13-year-old, let's just say, or a 6-year-old or whatever, and the patient wants to go in the room for the appointment. If the parent wants to go in the room and the patient says, yes, that's fine, you don't really know if that's okay for the patient because they might be saying that it's okay for the parent because they're like right there because they don't want to get in trouble. But in the course, it does say keep in mind that that might not be okay with the patient. So there's not much that you can do if the patient says, yeah, it's okay if my mom comes, you know. But they say they said in the course, it's always a good idea to actually not have the parents come back with them because we don't always know if that's okay with the patient or not. So I just wanted to mention that. Oh, Rita, yes. For the private lessons, I will let you know. I do have some times opening up in November. It's just we were painting, so like things have been all over the place, but I will let you know. Hey, you know, and that's totally up to you because I do talk about everything here anyway. But if you feel you need more, then just let me know. That is absolutely okay. No problem. I am always happy to help. Actually, I don't have a PowerPoint for this. And I'm not allowed to give you guys my course notes either because they say, or sorry, the like full thing that they had done because we're not allowed to share. Because I don't know why, actually, that's kind of weird. But at the beginning, we did sign something saying we're not allowed to share, but I am allowed to give you guys the points or my, you know, notes that I did have. So I can do that. Which I did post some actually on Facebook the other day. So there are some there now. But if I don't see any more questions, I will let you guys go. And you are so welcome. I will post this up in a couple hours when the session recording is done. And then I will just be asking if anybody has any more questions about that so far. And then to just kind of post under the post, or sorry, to comment under the post in Facebook. So I thought this was interesting. I don't know if I'm the only one, but I did quite like taking this course. It was very, very interesting. And there will be more for our next session. Yes, it is confusing for sure because I find it's not all common sense. For a lot of things, they usually are common sense, but not for things like there's no age of consent in Ontario. How does that help? And pretty much a 3-year-old can say that they don't want something and that's okay. Yeah, I agree with you. But you guys have a good Saturday and thanks again for hopping on. And for the next session, we can start half an hour later because I should be able to then. So I will change the session time under the events tab. And for November, I'll be posting the sessions probably by tomorrow too. Tomorrow at the latest, so you guys have an idea. But I do think the next few will be law and like ethics, privacy, because I find there's still a lot of questions. So yeah, so that will be the next few sessions. There will be, because I did have questions about this, there will be a dental assisting, what was I going to say? A dental assisting a board exam boot camp in November because a lot of you are taking the exam at the end of the year. So there will be a boot camp for that. So I do have a lot of things coming up. So everybody will learn so much. Oh, and Rita, I don't typically do the sessions during the week because I found that nobody would actually attend. So it's just kind of a waste of my time. So I typically do my private tutorings during the week. So I'm usually fully booked on that. But I think you said that if we start like a half an hour later on the weekend, like that's okay. Because let's see, we started at 10 today, so it would be 10:30. So like 10:30 till like 11:30. Okay, you guys, awesome. Well, have a good weekend. It's so cold out there right now, but have a good weekend. I will be posting this in a couple hours, and I will post the events too. If you guys have any more questions, please just let me know anytime. And thank you for hopping on early. I know it's early for some of you. So thank you guys so much. Have a great weekend. I will see you guys soon, okay? Bye. See you guys in a couple weeks. Bye.